Mama.
Hello, this is Clarissa and I'm going to be demonstrating a running locking suture, also known as a locking Banquet suture. These are the material, or the instruments I'll be using. I have 2 needle drivers, some suture scissors, and Addison thumb forceps. You can see these are for grabbing tissue, and they have sharp teeth on the end, known as rat teeth, and it's really good for grabbing tissue. I will be using a 4/0 braided polyester suture material. This is intended for student practice, not for human tissue, but it's an excellent product. It works really well. So I'm going to be using my needle drivers. Here's the suture and the needle material. I will be entering the tissue at a 90-degree angle, passing through the center of the tissue at a 90-degree angle, and exiting the tissue at a 90-degree angle. As I'm suturing, you need to grab the needle before releasing on the opposite side, because you never want to lose your needle in your patient's tissue. That would be terrible. Now I'm going to anchor it by creating a surgical knot. This is basically a square knot with the first pass is a double pass, and then the second pass is a single pass. I'm gonna repeat, double pass, pull through, single pass, pull through. Now I'm going to leave my knot on the left side of the patient's tissue, and I will trim this side. Now on my second pass through the patient's tissue, enter at a 90 degrees, pass through the center of the tissue at a 90 degrees, exit at a 90 degrees. Grab my needle, pull it through. So to create the running lock, here I have my loop, and I'm going to pass my needle through this loop, which will then create this square. This is my lock. Okay, and then I'm going to make another pass. Enter at 90 degrees, pass through at 90 degrees, enter at 90 degrees, exit at 90 degrees. So here's my loop, which I'm going to make sure that I go inside of. I don't remember if I said, but over here, this is a mattress stitch. I also secured with surgical knots. This is an interrupted, which are great for practicing surgical knots. And I also have some interrupteds over here. Okay. Again, enter 90 degrees. Pass through 90 degrees, enter 90 degrees, and exit at 90 degrees. Now, since polyester kind of holds its shape, so we'll have to make sure I'm in the right spot before I pull it tight. Appears to be a little bit tangled. That's okay. This is not a suture material that I would probably choose to use on actual tissue, because I prefer to keep the instruments in my hand while I'm working. Not everybody does that, and some people will instead enter, exit, and then use their fingers, which are gloved, to pull out the needle, but I just don't feel comfortable with that. So I'm using forceps on both sides. You could also use tweezers, but I just already have 2 needle drivers, so it's convenient and it works really well. You have to be careful though when you use needle drivers to exit to pull it out, because sometimes it can, oh, where's my camera? Sometimes it can, there it is. It can cause the integrity of the sharpness of the needle to diminish. So you just have to be really careful to not grab the actual tip. And I accidentally clipped my suture material when I was pulling it. But you can see right here this beautiful running locking suture, also known as a running Banquet suture. And doesn't it look so nice? And then I would end with a surgical knot again.